right, so now I'm streaming live on my channels as well. All right, good morning, everyone. Good morning. Good morning, everybody. This is Dr. Nurse Paul, and we are going to do another round of NextGen NCLEX case study class today. I've prepared two cases. So if you guys are joining me today, use the comment section. We have viewers coming from Ghana, princesses from Nigeria. Hello, everyone. Thank you for joining us. This show is hosted by AMN Academy as well as Aspire RN and Dr. Nurse Paul. You can follow me on my social media pages at Dr. Nurse Paul. And we're doing a class today about NextGen NCLEX. So who among you guys are going to take the NCLEX soon? Can you guys share, or are you guys going to take the NCLEX sometime in the future? So for those who do not know me, I'm a NextGen NCLEX expert, 16 years of teaching NCLEX, particularly to international graduates or graduates outside the US or Canada. All right. I think I'm having issues with my camera. I think it's freezing. But yeah, so that's what I'm saying. I've been an NCLEX instructor for 16 years. I am now based here in the United States. I'm streaming live from Houston, Texas, here in my office. Oops. I'm streaming live from my office here in Houston, Texas, and it's 7 a.m. here. And we are going to do two case studies today. All right, apologies for my camera freezing, okay? And that's it. So please join me. If you guys are joining me today, please share where you are coming from. Tag your friends and share this to your pages so so we can start. Just share this one more time to one of the groups I manage. So more students can join us. All right. And anyone going to take the NCLEX soon? Hi, Haley. Haley is one of my best friends for joining us today. We have could not read the name in Chinese characters. She is watching us from Germany. Bernard is joining us from Nairobi. Jorley, one of my followers, is joining us from Qatar. All right, very nice, very nice. Thank you so much. All right, and we are about to start soon. Okay, so if we can maximize the screen for the PowerPoint slide. There you go. Who's ready for a NextGen NCLEX case study today? Anyone? I'm sorry about my camera freezing. It's really freezing terribly. Let me see if this can fix it. Yep. Okay. Rainy afternoon here in Saudi. Shelly is joining us from Riyadh. Jean is joining us from Qatar. All right. And for those who do not follow me yet, please follow me, Dr. Nurse Paul. We'll be doing lots of classes. By the way, give you an overview before I start. This show again is hosted by AMN International Academy in partnership with Aspire RN and Dr. Nurse Paul. I do this every month, every third Monday of the month. I do 1 hour free class live in AMN International Facebook page, in my own page in Facebook and YouTube. All right, so please follow me in AMN Academy for more information about services we offer. I'm an NCLEX instructor. I do my virtual classes under Aspire RN, and my website is aspirern.com. If you are interested to enroll in a review program, you can follow me there and see courses that I offer. We're going to talk about that later. All right. Okay, I think we have enough viewers to start today. All right, who's ready for another NextGen NCLEX case study? Everybody who's ready, say, I am ready. Good morning, Antoinette. Antoinette is one of my followers, and she's joining us today. All right, so we have nurses from the African region, Europe, Asia. Anyone here from the US? Hello, Yoli. All right, more people are joining us today. All right, so this is also live streaming on my page right now. So please follow me. Very good. Rebecca says she's ready. Marilyn is from New York. All right, awesome. We're all over different time zones today. I love it. So if you guys are ready, we're going to use the comment section for our case study. Okay, so let me start with the case. Okay, so for the case study today, there will be two cases and we will be using bow tie. Bow tie is a form of NextGen NCLEX, and NextGen NCLEX is super new. We just implemented that last year, April 1, 2024. For the most part, I have a lot of students that like the NextGen NCLEX format. It has a lot of information, but more information gives you more clues to pass the NCLEX. All right? So don't be scared with NCLEX. We have a little bump in the pass rates for international graduates after NextGen NCLEX was implemented. We're now up to like almost 50% from 43% in the preceding year. So apologies if my camera is lagging. Yes, so NextGen NCLEX is the new format of the NCLEX. This is new. We just implemented this last year. It's turning 1 year, all right, on April 1st, which is in 2 weeks. And for the most part, a lot of my students like the NextGen NCLEX, all right? But NextGen NCLEX is only a fraction of your actual NCLEX, probably less than 30% of your actual NCLEX. So for those who do not know what is NCLEX, NCLEX is the licensure exam to become a nurse here in the United States, in Canada, and if you are an international graduate who wants to practice in Australia, you would also need to pass the NCLEX. I hope my voice is not cutting. I know my camera is lagging, so I hope my voice is not cutting. Is my audio clear? Is my audio clear? Yes? All right, Punita is joining us from Nepal. Very nice. CF is joining us from Finland. Anna is also watching me on my page. Maria from UAE. Thank you. Felicity from Ghana. Thank you. Please follow me on my social media page at DrNursePaul. I am in Facebook, Instagram, YouTube, TikTok, and LinkedIn. Right, so I provide free NCLEX classes every month together with AMN Academy. I do this every third Monday of the month. Third Monday, if I said it correctly. But I also do free classes. If you guys go check my YouTube channel, I have a free EKG class over there that I did last month, and it's now uploaded in my YouTube channel. It's a full EKG class. It's 3 hours, very informational. Join me right now on YouTube. You can see it there as well. Okay, so without further ado, let's start our first case. Let's take the quiz. This is our first case. We're going to do 2 cases. So today, if you can see on your screen right now, this is how your bow tie would look like, all right? I think that's my screen right there. So this is how your bow tie would look like, all right? So there are 5 boxes in a ribbon style, like a bow tie, right? You always start with the middle. When you're answering it, you start with the middle, followed by the left wing, and then the right wing. So the way to answer that, you start in the middle, followed by the left wing, and then the right wing. Okay, so that's how we answer your bow tie. So for bow tie, we're going to read a case study first. All right, we're going to read a case study. Will this be posted after live? Yes, it is actually posted directly. So after the live, EJ, you're going to see the recorded version in my Facebook and YouTube. You're also going to see it in AMN International. Nell Joyce joining us from Dubai. All right. So let's read the case. We have 4 tabs open: nurses notes, physical exam, labs, diagnostics. We're going to go through that one by one. Let's read the case right now. 28-year-old male was brought to the ED via ambulance at 2:00 p.m. after a motor vehicular accident. This is an MVA case. Looks like a trauma, guys. 14 o'clock, patient was brought into the ED room 4. He was the driver in a collision and was wearing his seatbelt. Upon arrival, patient was conscious but appeared disoriented, confused. He complained of a severe headache and nausea. Observations noted a laceration on his forehead and bruising around his seatbelt area. He has no recollection of the events leading up to the accident. Blood pressure 130 over 85, pulse 100, RR20, temperature 37 Celsius. At 1410, trauma surgeon was paged. At 1420, trauma surgeon was at bedside assessing patient. And at 1445, patient is transferred to OR. ED nurse gave report to OR nurse. All right. So those are the information we had from history and chief complaint. Let's go to your physical exam. If you click that, we see your physical exams here. Let's start with the vital signs. Any abnormality with the vital signs, yes or no? Any abnormality with the vital signs? We have a lot of viewers today. Very good. Any abnormality to the vital signs? Everyone? We have 206 viewers in my Facebook page. Wow. BP is a little bit high. The rest is normal. Very good. So for me, I'll leave the BP alone. That doesn't sound a red flag to me. With trauma, one of the things I look for is shock, right? So with shock, if I'm suspecting shock, then the blood pressure would be low. So I'm not going to be worried about that now. That looks okay to me. How about constitutional? Patient appears disoriented and anxious. Neurological, patient is disoriented to time and place. Rostum, I agree with you. All right. 130 over 90 is slightly elevated. That is true. The normal blood pressure is 110 over 80. So 130 over 90 is a little high. But also, I'm not going to be worried about that. I'd rather a patient with trauma that has a little high blood pressure than low blood pressure because of sepsis, or I'm sorry, hypovolemic shock, bleeding, right? Pulse is on the higher end. Temperature, because people are still responding. Temperature is normal. In the NCLEX, here's the thing, right? If the value is normal, do not question it. That's not part of the problem, okay? That way you can get rid of it and not have to worry about it. So temperature is 37. In the States, we don't consider it as a fever until 100.4, which is 38 degrees Celsius. We do Fahrenheit here in the US. So unless it's 100.4, it's not a fever for us. All right, that's 38. So when you're taking the NCLEX, you use the American values or normal values because you are going to take an American exam. Okay, so forget what you've learned outside the US for a bit. All right, neurological. Patient is disoriented to time and place. GCS score of 13. What is the normal GCS score, everybody? We have 250 viewers in my Facebook page. So please utilize the comment section for your answers. What is your normal GCS? Your normal GCS is about 15, right? So 13 is a little low, okay? Your head, eyes, ears, nose, and assessment, we have lack on the occipital region, approximately 5 cm. This is about 2 inches. No active bleed, perla. Pupils are equally round or active. To light accommodation. Hi, Neri. How are you? Neri is one of my friends from college. Mark. I have a lot of people that I know joining us in Facebook Live again today. Thank you so much for joining. Pulmonary, normal respirations. Cardiovascular, normal. Gastrointestinal, normal. Musculoskeletal, we have abrasions. Genitourinary, no abnormal findings. So what we see so far is there are neurological symptoms, correct? And probably, like you said, probably vital signs that are on the higher end, all right? So are you guys formulating your possible diagnosis already? Let's look at your labs. Let's look at your labs. Labs for the white blood cells, 7.2. That looks normal to me. RBC, 4.9. Hemoglobin, 14. All right? Hematocrit, 42. Platelets, 225. Is the CBC normal? Mark, you review NCLEX with me, okay? Is the CBC normal? Yes. If the CBC is normal, particularly in trauma, I'm going to look first in H and H. When I say H and H, anyone here ER nurse? Because you're going to be getting a lot of traumas. I'm a trauma certified nurse as well. All right. Joanna is also here, which was my student from a long time ago. I've been a teacher for 16 years, and I'm now based here in the US. Back then in the Philippines, I'm originally from the Philippines. I taught there for 10 years. after I graduated nursing, had a little clinical experience, I started teaching. They needed a lot of faculty at that time. So I became a licensure exam expert. And then that's how I started my career. And now I'm here over the US. But, I'm partnered with AMN Academy for bringing nurses here to the US with me. My main role is to help their nurses pass the NCLEX, but I also own my own company, Aspire RN. So my advocacies, if anyone's following me on social media, and I know a lot of you are watching right now, there are now 280 viewers in my Facebook alone. All right. Wow. Thank you so much. But my one of my advocacies is to help nurses come over here smoothly so you guys don't get abused or something like that. And I know AMN is one of those agencies that I can trust, that I actually refer my nurses to. All right. Anyway, for CBC, if the H&H is normal, I rule out bleed quickly. All right. But again, this might change, right? But at the moment, do not question the question. H&H is normal. We're going to rule out bleed. CMP, comprehensive metabolic panel, what we see are sodium, potassium, creatinine, and glucose. Everything looks good. All right. We're probably going to need creatinine if we're going to do CT angio. Sodium and potassium are important. Potassium can elevate whenever there's cellular damages. And that's it. That's all the information we have so far. For coagulation profile, it looks everything is normal. I'm particularly going to look at INR and APTT. Both are normal, so we're ruling out bleeds. Wow. Paul. Paul Rivera said hello, ka birthday in English. Hello, how do you say that in English? We're friends with the same birthday. And Paul was my student from what? What year, Paul? 2009? My goodness, I feel old already. 2009. Thank you for joining us today. Mark said, certified and proud to be Sir Paul's product. Oh, thank you so much. Some of these nurses are my students before in the Philippines. Donna is one of my NCLEX passer. Hi, Donna. Wow, thank you so much. I didn't realize a lot of people are joining us today. But look at the EKG, guys. EKG, normal sinus rhythm. Chest X-ray is normal. Head CT. What did we see in head CT? Pay attention. Pay attention. Look at the screen. But thank you guys for joining me today, okay? I didn't realize this. And again, follow me social media, Dr. Nurse Paul and AMN Academy. I do this with AMN Academy every month, third Monday of the month. So thank you, AMN Academy. Thank you, Miss Milanes, for moderating the class today. Subdural bleed. Thank you, Shilly. Jorley, yes, we have an abnormal CT finding. Very good. And spinal x-ray was normal, so we're ruling out cervical fractures, right? So our focus now is on the head, all right? Are we seeing a traumatic brain injury here? Yes. And what are the possible, complications you should start thinking about this now? Now we're ready to answer your questions, all right? We're ready to answer your bow tie. Bow tie is a very unique type of question in the NextGen NCLEX. This is new. We don't have bow tie before, okay? So again, when we answer bow tie, I told you guys to start in the middle. It actually says there in the instruction. Let's read the instruction. Complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. 2 actions the nurse should take and 2 parameters the nurse should monitor. So you start with condition, most likely experiencing, which is the middle. In the actual NCLEX, I'm using PowerPoint right now. So you obviously see at the top, PowerPoint slide, right? In the actual NCLEX, you're going to click and drag. You're going to click and drag. You're going to click and drag, but you can't do that right now, okay? So what condition will be most likely experienced? We have a total of 5 points to accumulate in this question. Anyone? Laurel, thank you. Laurel said, good luck to all aspiring nurses, NCLEX passers. Do it, guys. Focus. God bless. Thank you. Dodong already has answers. Ryan has answers. Rostum Flores has answers. How about the others? May I please see your answers? We now have 300 viewers in my page alone. We're not even including AMN page. Thank you so much. Thank you. But this will be short. 1 hour only. I wish I could do this often, but I'm also a busy person. All right. While waiting for your answers, guys, I have a little segue. All right. I also work as a nurse practitioner here in the States. So I used to work as an ER nurse, and now I'm working as an urgent care nurse practitioner. So kind of busy clinic. I see sick patients all the time, right? I do miss ER, but I do like my shift in the urgent care and great benefits as well. All right, let's look at this. Condition most likely is subdural hematoma. Very good. Now, what are your actions to take? So obviously we have subdural hematoma. We have traumatic brain injury, TBI, right? So that's a trauma code, right? That's why we have to call the OR right away, right? But oops, I think I said one of the answers. What are your two actions to take? Come on. And we still have another case after this. I prepared two cases today. What are the two actions to take? How about monitor for neurologic status Q 15 minutes? Yes, we're going to answer that. I can't do that. I can't drag it to the top right now because I'm using PowerPoint. This is just a PowerPoint presentation. How about administer antibiotics? Is antibiotic our priority right now? No. Which emergency case would you prioritize antibiotics? Which emergency scenario would you prioritize antibiotics? Antibiotics would be prioritized if the question talks about sepsis, correct? We're not talking about sepsis right now. We're talking about a trauma that needs to go to the OR. Our problem with hematoma, it can increase the pressure in the brain, correct? Any OR nurse here? Any trauma nurse? Any ER nurse? The immediate management there is to go to the OR right away so they can drain that pressure out, otherwise ICP. So we're not going to do antibiotics. How about thrombolytics? Thrombolytics for IV, hello? Thank you, Niners. Thank you, Sir Irvin and Niners family. I love you guys too. Niners is one of my partners, company partners for English. I'm also a Niners product for English school. All right, I went to English classes with them to take my IELTS. As everyone know, before we come here to the US, we need to take an English exam, correct? So Niners, they helped me out in 2016, 8 years ago, I think. And I've been here in the States for 7 years. So I hope I can get a 7.0 right now with my English using the American accent. Thrombolytics is not needed. Very good. Very good, everybody. No, because the patient's already bleeding. That is correct. Hematoma is a bleed. Plus, where do we use thrombolytics? Which potential conditions here do we use thrombolytics? It is the stroke. So we're not going to do that because we're talking about subdural hematoma. Stat referral to surgery. Yes. How about administer anxiolytics? Not a priority. All right. You may give pain, anxiety medication. Morphine is good for both pain and anxiety, but it's not a priority right now. It's just to comfort the patient. But our top two priority actions to take are monitor neurologic signs because it's a trauma code. You have to monitor every 15 minutes until they get transferred to the OR, especially for ER nurses who are going to practice here in ER. Trauma is one of those big things in the ER. Your charting should be on point here. And stat referral to trauma surgery. Usually with level 1 and level 2 trauma, we have 24-hour coverage of trauma surgeons in the hospital. So they would go to the OR right away. That's why as soon as we page trauma code, the surgeon would be there within 5 to 10 minutes. All right. And then they would decide if they're going to keep them in the ER to do some procedures, some minor operative procedures they can do, or transfer the patient stat to the OR. And then we have OR nurses, trauma team in the OR as well. Sometimes they go to the ER as well whenever we have traumas. So it's a multiple specialty. Respiratory therapists are there, radiologic technologists are there as well. The radiologist is on standby to read CTs and X-rays very, very quickly. So it's multidisciplinary is what we call it. Now let's go to parameters to monitor. Go. Parameters to monitor. How about we choose Glasgow Coma Scale because it's neurologic? Yes or no? Of course, we need to monitor GCS, correct? We have to monitor neurologic status for 15 minutes. One of your parameters is GCS. What else? Cardiac telemetry. Well, I have normal sinus. So while cardiac telemetry is correct technically, because I mean, if it's a code patient, you should put them in telemetry, right? Right? Because it's a high acuity patient. Everybody that's high acuity in the ER gets telemetry, all right? EKG monitoring. Lung sounds are maybe correct as well. Foley cath, obviously the patient's going to the OR has Foley cath already with traumas. We put them in Foley right away because they're going to be in the OR, right? My focus is neurologic. Agree? Yes or no? So the answer is ICP sites. Very good. Look at the screen right now. The answers are there. Who got 5 points? Wow. We have a lot of viewers. Thank you so much for my followers for joining me today. All right. And I haven't been posting a lot in the last month. If you see my February doesn't have a lot of activity in my Facebook. I was very extremely busy. All right. Families coming over, friends coming over to the US. I had to tour them, busy at work, busy with classes. Who got 5 points? Who got 5 points? Because we have another one. So hold your horses. We have another one. I just want to know who got 5/5 here. What's your score for our first case? By the way, the NCLEX screen will similarly look like this. All right, so same colors, and you have your calculator there. You have your next. Of course, you don't have your logo of my company, the Aspire RN, and the DrNursePaul over there. All right, very good, very good. Did you guys enjoy the first case? Are you guys ready for another one? Are you guys ready for another one? All right. Everybody who will pass the NCLEX, can you guys say in the comment section, yes, I can? I want you guys to put, let's manifest this. I will be in the US in the future. I will pass the NCLEX. Say, yes, I can. Can we do that? And some of you guys are my students already in Aspire R and joining me today. I have a class after this. At 8 o'clock, it's 7:30 now, I have a class. Oops. Okay, now there you go. I think I was lost for a minute. Sorry about that. I'm having technical glitches. I think it's my internet. But everybody who will pass the NCLEX will be practicing here in the US in the future. Say, yes, I can. Very good. All right. Okay. And which part of the US do you guys want to go to? For those who are not yet here, a lot of you guys are still waiting to get here to the US. The first step is to pass the NCLEX. That's why I'm here. My role is to get you guys through the first step, all right? My role is to guys get you to the first step of the American dream, which is to pass the NCLEX. After you pass the NCLEX, there's more hurdles, challenges to go through, immigration processes, your English exam. Niners is there, very, very good company. I love them. And the CEO of Niners is also very dedicated. Irvin, shout out to you. Thanks for all you do for nurses. And also your visa screening, endorsement to whatever state, moving to the US. If you guys follow me on Facebook and in whatever social media, I do a show every Monday. It's a talk show. It's a podcast with my co-hosts, Anna, which was here earlier in the comment section. She was messaging, and Nurse K. So we do what we call DNP Unlock, the Disruptive Nurse Perspectives, an immigrant nurses talk show. Even if you're not here in the US yet, it's like going to school, right? You want to go advanced classes, or you want to read before you go to class, right? Before you come to the US, try to get to understand what the US feels like, all right? So we already did 23 episodes. Our 24th episode will come out on Sunday. View that. We've talked about all immigration issues, what you're gonna do when you're new here in the US, what are the problems we've encountered, so you don't have to go through that, how much money you're gonna bring into the US, right? How do you find different jobs, where to find jobs when you finish your contract, so many things, all right? So please join me in DNP Unlocked. We also stream that on YouTube, and it's gonna be available soon in podcast in Apple and Spotify. We're already waiting for approval, all right? But that's something to help our immigrant nursing community. And as you guys know, that's one of my advocacies. Make sure that you guys are not only coming over here to the US, but your transition will be smooth, all right? That's what I advocate, so you don't get bullied, you don't get harassed, you would know what to do once you get over here, all right? Somebody wants to go to Texas, Lane. Jobel wants to go Arizona, very good, all right? Who else? All right, Language Learner Vibes doesn't use social media platforms, but you're on YouTube, so thanks for that. And Awura is joining. Awura said, yes, I can. All right, very good. Rochelle wants to practice in NYC and Cali. Wow, that's good. Anyway, let's go to our next case. This is our next case. Let's read it now. All right. This is our final case for today. 10 o'clock, we have a 38-year-old female brought to the emergency department at 3 o'clock p.m. It should be 10 o'clock. I'm sorry, guys. I did this past midnight last night. I'm a late sleeper. After experiencing palpitations, tremors, and a sudden increase in body temperature. Over the past week, she reported feeling increasingly anxious, having trouble sleeping, and significant weight loss despite an increased appetite. So you guys are picking up a lot of signs here already, right? Increased body temp, palpitations, tremors, anxiety, trouble sleeping, insomnia, weight loss, right? I think I'm formulating a diagnosis already just reading the case. Mia has a history of hyperthyroidism, but she's irregularly using her prescribed meds, right? So that's dangerous. They should be taking their meds, right? All right. So on examination, Mia appears agitated, sweaty, right? What else are we seeing there? With the noticeable hand tremors and exophthalmos. All right. Ryan already has an answer. Physical exam. Anything outstanding for you guys here? I'm going to give you guys 30 seconds. Tell me abnormal findings that you find in your physicals. Go. Go. Ralph already has an answer. Very good, Ralph and Ryan. They're like 5 minutes ahead of the class. Happy wants to go to North Carolina. Tell me your abnormal findings. Go. Go. Vital signs is abnormal according to Guyang. I hope that's your real name. But I understand if you guys have to use a different name for privacy purposes. Vital signs, yes. We have elevated blood pressure. There you go. That's significant. Pulse is 130. We don't like that. Respiratory rate 24. Temperature 39.5 or 103.1. All right. 103.1 is high. What else? So vital signs is abnormal. What else? Anyone? Anyone? Help me out. I still have 280 viewers in my Facebook account only. Thank you so much, guys, for joining me today. And some of you might be at work, so please respond to the call bell first of your patient before you answer me, okay? Neurological looks normal. Really? I thought I've seen difficulty of focusing there. And tremors, right? Constitutional has restlessness there, diaphoresis and agitation. HENT, we've seen exophthalmos. Guys, put your exact finding, all right? What else? Thyroid gland is enlarged on palpation, and pulmonary breathing is slightly labored, and cardiovascular tachycardic. The rest are normal. So those are abnormal findings so far. How about your labs? Let's look at the labs. Any significant finding? I made it easy for you guys, all right? I put within normal limits already. In the actual NCLEX, they might write the whole lab, all right? So that's time consuming for you because you still have to find, is this normal? Is this abnormal? All right, so I made it easier for you guys because we have limited time, right? This is only 1 hour and I have a class later as well. All right, so what is it? So you see your TSH is low, right? Your free T4, thyroxine 4, and T3, triiodothyronine, are both elevated, right? When you have low TSH, high T4, T3, what is that? Is that hyperthyroidism or hypothyroidism? Obviously, when the T4 and T3 or thyroid hormones are elevated, is that hyper or hypothyroidism? Hyper or hypothyroid? Hyperthyroid. And we can actually, the first thing that we check here in the US, primary test that we do, the guideline is to check TSH first. So with me, if I'm suspecting a patient has hypothyroid, we do TSH. So we can screen TSH yearly. If that's extremely low like that, then we can do thyroid profile test, T3, T4, TPO, all right? It's not here, but we already see that this is a hyperthyroid case. Let's look at your diagnostics. You see an EKG there on lead 2, all right? What do you think about the EKG? I just told you guys earlier that I did a free class in EKG, and it's now uploaded in my YouTube. Can everybody follow me on YouTube and share those YouTube videos that I've done? It's under NCLEX lecture playlist. I did an EKG class. All right. I'm not sharing. All right. But there's an EKG class that I did in my YouTube channel. All right. So sinus tachycardia, very good. So if you see this, I'll start here because it's close to the line, all right? You see from one R to another R is less than 3 boxes. 1, 2, 3, 3 big boxes or large boxes. That's more than 100 because one R to another R in one box difference is 300. 2 box difference is 150. 3 box is 100. But you see it's slightly before the third box, right? So for me, it automatically is more than 100. And this is a 6-second strip. You see the 3-second marker there, right? 3-second marker, 3-second marker. So that's 6 seconds. What you do, another option is to count all the R's who attended my EKG class or who are my students here who I taught this because I love teaching EKGs. You count all the R's in a 6-second strip. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. You multiply that by 10. Very good. So what's our possible heart rate? 110. So you guys see what's happening here. In the actual NCLEX, they're going to show you EKG strip. They're not going to tell you what it is. They're going to show you an EKG strip. That's part of your competencies to learn basic EKGs. All right? So if you want to learn about EKG again, where do you go? Where do you go? Do you want to go to my YouTube channel so you can learn more EKGs? Yes or no? Yes. And tell your friends about that as well. All right? Because it's out there. There's so many free lessons out there. I do free classes to help you guys. All right? So the resources are out there. No abnormal findings. So we have sinus tachycardia. Okay, now let's go answer the question. What's your answer? Give me your conditions most likely experiencing, 2 actions to take, and 2 parameters to monitor. It's already uploaded to my YouTube, guys. I actually did an EKG class back in February. All right. What's the answer? I'm waiting for you guys. We have 300. We have 300 viewers in Facebook. Wow. Wow. We have 300 viewers. All right. Thank you for joining us. Thank you for joining me. Thank you for AMN Academy for hosting this show. All right. Thank you to AMN International for taking care of our nurses and for hosting this show, for trusting Aspire RN and DrNursePaul to conduct this show. We still have the scholars from AMN. Thank you for the partnership. And for you guys that are wanting to come to the US, well, here's the free class. What's our answer? Thyroid crisis. Very good. How about 2 actions to take? We know it's thyroid crisis based on the labs, physical exams, and the diagnostics that we have here. All right. How about the heart rate? Remember, the heart rate is about 110, right? Do we want to slow it down? Because the patient can have VTACs. Yes or no? Patients can have VTACs, correct? Correct? So we want to give beta blockers to lower the heart rate. Agree? Give me example of beta blocker. Go. Give me example of beta blocker. Let's just do a little segue. Give me a good beta blocker that we can control this with. How about metoprolol? Yes. How about carvedilol? How about labetalol? Those are the 3 most common that we use here in the US. Metoprolol is good because it's selective. It decreases the risk for bronchospasms, although it still carries that risk, but not so much with the lungs, all right? Because it's selective, all right? What else? Do we administer hydrocortisone? Hydrocortisone is for adrenal crisis, correct? It's also anti-inflammatory for patients that need steroids. It's a steroid. How about methimazole? Is methimazole one of our medicines for hyperthyroid, for thyroid crisis? Yes. Methimazole is an anti-thyroid, right? We want to give that right away to stop the thyroid hormones from causing all these sympathetic responses to the cells. Administer IV fluids, that's not our priority. Apply cooling blanket, that's not our priority right now. The answers are beta blockers and methimazole. How about parameters to monitor? Parameters to monitor. How about vital signs? Yes or no? Yes. How about continuous cardiac telemetry? Yes, because like I said, the complication is VTACs, ventricular tachycardia from too much thyroid hormones. Do we prioritize bowel sounds right now to monitor, to evaluate the outcome? No. Do we prioritize rechecking AST, ALT, alkaline phosphatase, and albumin? No. When you're checking for AST, ALT, alk phos, and albumin, what are you looking for? What are you looking at? What organ are you looking at? That's the liver, right? So you prioritize that if you're thinking about gallbladder with biliary obstruction, pancreatitis with biliary obstruction, hepatitis, liver failure, liver cirrhosis, liver cancer. We're not going to prioritize that right now. How about check BUN creatinine EGFR? You're checking that if you're checking for kidney function for patients with risk or complications of kidney failure or renal failure. So that's not a priority. Answer is vital signs and cardiac telemetry. Who got another 5 points? Very good. Wow, thank you so much, guys, for joining me today. I appreciate y'all's time. I'm not worthy of y'all's time, but I hope you enjoyed my little presentation. Did you guys enjoy this? Mental drill. Some of you are already NCLEX passers. For those NCLEX passers, can we send good vibes to those nurses that are about to take the NCLEX? Somebody said, thank you, sir. Tomorrow again, please. I wish I could teach every day. I do teach every day, almost every day. For my students, I actually have a class in a little bit. I have 2 classes today, 3 actually. This class, another class at 8 a.m. and another class at 8 p.m. So I teach nurses from more than 40 countries all over the world through Aspire RN. Okay, thank you guys so much for joining me. And if you guys are interested, follow me at Dr. Nurse Paul. You can also check my NCLEX website, aspirern.com. Thank you again to AMN Academy for hosting this show. In Aspire RN, we have intuitive online portal. Everything is online. We have NGN Ready, NCLEX test banks. And one of our best feature, we have individualized monitoring. My students know this, all right, and can attest to that. And with Dr. Nurse Paul, when you partner with me, you get NGN confidence, just like what I did today. I'm going to teach you guys how to dissect that properly and be confident with answering those NCLEX questions. Personal mentorships, and your passing is Dr. Nurse Paul guaranteed, which means if you fail, I'm going to take you back until you pass. All right. And these are the different courses. My best course is full course for nurses. The main course runs for 16 weeks. You can go as fast or as slow as you want, depending on you. Majority of my students are working students. So some of them, in between work, they come to classes. If you missed your live classes, it's recorded. You go through 3 different phases. We call it the Dr. Nurse Paul method, or DNP, didactic, neuro, and precision phase. And all the way to final coaching. 16 weeks, 1 year access, unlimited access until you pass. All right. We have 98% pass rates. And you also have your short courses, crash courses. This is a 10-day course only. You join my HIT classes or final coaching classes for 10 days. But you will have access to the course for about 45 days, all right? And I'm offering 30% off on all my courses today, all right, if you use the code Dr. Nurse Paul. For my Filipino followers, all right, in respect to my Filipino heritage, I'm offering a very special price. Look at my Aspire RN page right now of 20,000 pesos only, all right? That's a heavily discounted price. 20,000 pesos only. Installment is offered. Message me at Dr. Nurse Paul. Me or my team will get a hold of you and talk to you as well. And don't forget to follow AMN International, because every Monday we do free classes. All right, free classes every Monday. So it's different teams per Monday. I'm assigned to third Monday. All right, I'm assigned to every third Monday. All right, so that's it. So follow me, Dr. Nurse Paul, AMN Academy. We do free classes as well through AMN International. And thank you so much for everyone. Share this to your friends. This is recorded in Facebook and YouTube. Tag them on my page or AMN Academy so they can watch it later after they go out of work. Thank you guys. Appreciate your time. I'll see you in my next free classes. Follow me on Facebook, and I'll post there my next free classes next month. Bye.